Hello and welcome to the PEBB 2021 Pre-Open Enrollment webinar for state agencies. My name is Jamie and I have Larry here with me today. Larry is going to kick off the first half of the presentation and then I'll take over in the second half.
These webinars, again, were recorded and posted on the PERS-Pay website for state agencies. The schedule for the webinars. And today, the state agency is October 5th. Of course, we know that we're here. October 12th, the higher education institutions. And October 19th for employer groups. So again, 3 different webinars, state agencies, higher education institutions, and the PEBB employer groups. On the agenda today, again, we're going to talk about general open enrollment information, medical plan changes, premiums, dental, life, and AD&D, and long-term disability, medical FSA and DCAP program, 2021 rule changes, worksheets update, and a reminder. And you're going to see here between agendas 5 and 6, we're going to have a little break there, 5-10 minutes. All right, open enrollment information first. And annual open enrollment this year, again, every year it's going to be November 1st to November 30th. And all forms need to receive before, no earlier than November 1st and no later than November 30th. The signature on the form must be prior to November 1st. So again, we don't want to be using 2020 forms in order to make changes for 2021. Again, those new forms are not going to be available until November 1st. We want you to use that 2020 form. Again, all changes are going to take effect on January 1st, 2020. And again, a little different this year. I've been doing benefit fairs for 26 years. No in-person benefit fairs this year, with the COVID-19 stuff going on, all going to be virtual benefit fairs. As far as that concerned, again, the online virtual benefit fairs going to be available 24 hours a day, 7 days a week. What kind of information they're going to provide for you? Again, benefit options and plan availability, plan comparisons. There'll be some informational videos. Also, webinars going to be out there for people too to take a look at, helping decide on which plan they may want to select. Again, you want to visit the PEBB Open Enrollment webpage for more information. Here's a link for you for that. Again, the benefit fairs in person will not take place this year due to COVID-19. Employee open enrollment communications, again, we're going to email or mail out in October for state agencies, higher education institutions, our newsletter. And this is our only notice that we're going to have for employees about open enrollment. So again, we got to make sure people have the right addresses. So make sure they get those newsletters. Again, also will be available online for people too. Also included those newsletters, again, information, notice credible prescription drug coverage, and also summary of benefit change notice, benefits and coverage notice. Now, has everybody signed up for Gov Delivery? Again, you want to go to that PERS-Pay website and sign up for Gov Delivery because, again, you're not going to get any information about open enrollment without being there. Also, too, we're going to include their email message to forward to your employees. Again, sign up through that Gov Delivery there. Again, so before open enrollment starts there, so you get this information that we're going to send out to you. Again, you must be registered for Gov Delivery in order to receive these messages. How do I sign up for Gov Delivery? Here's a PERS-Pay website. You can look on the left-hand side there under Toolbox. Under Toolbox, you see sign up for outreach and training messages. And then you want to enter your email address and go ahead and submit that and sign up for the Gov Delivery. Again, it's going to be available on the PERS-Pay website under Toolbox. What can employees do during open enrollment? Of course, they can change their medical and dental plans. They can enroll in PEBB Medical without proof of loss if previously waived. And we know outside of open enrollment, everything requires proof. But during open enrollment, you can enroll in that medical coverage without proof of loss if they previously waived. Now, they can only waive medical if they have options for TRICARE Medicare, or other employer-based group medical. Little side note that coverage under health benefit exchange is not considered employer-based coverage. What else can employees do during open enrollment? They can add eligible dependents without proof of loss. But if they do that, though, they have to provide dependent verification, and that has to be in before the end of November. So again, if I want to add my son or my daughter, I can do that during open without proof of loss, but I must provide that dependent verification before the end of the month. Okay, you have to provide a dependent verification, or you will not be able to add your dependents. There's a list of valid DV documents available on the PEBB website. You could also ask questions through the queues in order if you have want more information about that. You can also remove dependents from medical and or dental plans. You could change premium deduction to pre or post tax. That's RSC section 125. You can also change the tax status of dependent, RSC section 152 during open enrollment. Changes can be made through forms or online. The reason we're pointing this out to you is that in order to add a dependent to medical dental, you're going to have to use the enrollment change form. Unfortunately, online, you're not going to be able to do that because you have to provide dependent verification. Whether those forms are online, you can change a medical dental plan. You can remove a dependent from medical dental, use the forms or online. You can waive enrollment in medical. You can enroll medical if previously waived, and you get to attest to the premium surcharge for the spouse. So you need a form or online for that there. And the very bottom there, you change the pre-tax to tax status dependent using the declaration of tax status form, or change the premium deduction to pre or post tax using that form also. This year, we're going to have updated enrollment change form. Again, that's only available starting November 1st. If you receive a newsletter that we received here in September, that information will be inside there for you. So when you fill there, the gender identity field, it has to be either male, female, or X. Where it used to be the sex field will be renamed as sex assigned at birth. Then also too, the employer section was on the bottom of the first page, has been moved to page 10. So that's going to look a little bit different than the past. That's going to move to page 10. It used to be at bottom of page 1. The form we had available online will be a fillable PDF format. It'll be on the forms of publication part of the PERS Pay and also the PEBB websites. Here's a look at that form and what it's going to look like. Off the right here, you see the sex assigned at birth. And you also have gender identity here. We have the PEBB Program My Account. Make sure your employees go out there and sign up at My Account because again, all information about their enrollment will be in there all year long. They can look at their accounts, see who's dependents enrolled, what medical plan they're enrolled on. They can do that all year long. But during open enrollment, they will make certain changes to My Account. They also get access through a phone. So it doesn't have to be through a computer. You can also do mobile access to My Account through your phone. Very important too. This is make sure people go all the way to the end there and receive a confirmation of the changes that were made online. What I personally would do is that you may have saved a screenshot or print the copy of confirmation there to make sure they go all the way to the end when we're actually making changes. Again, that My Account can be used to view their coverages, medical and dental, the basic life and AD&D insurance. Again, your supplemental life and AD&D is available through the MetLife Benefits Portal. They can also do basic, supplemental, and long-term disability insurance through My Account. Myself, I sign up for what we call email notifications for PEBB. So if I get the newsletter, they're going to send me email notifications. The newsletter is ready to view. Here's where it's at. And I don't get a hard copy of newsletter at home. So again, I got signed up for email notifications for that through my account. And also too, during the year or anytime really, they can print out a statement of insurance. Statement of insurance there, again, will state all the current information, but the new changes they make for 2021 will not be viewed until after the change is effective. So again, if they try, I go out and make a change online and think it's gonna be right away, no, it's not gonna be, a change will not be displayed until the change is effective. Because again, state of insurance will display only current information only. They can also use my account to attest to tobacco premium surcharge. They can do that all year long. Again, ask any family member 13 and older who has a change in tobacco use. The spousal or state registered domestic partner premium surcharge is only going to be available for the months of November and December. Employees can't use my account when you add dependents not currently enrolled in medical or dental. They can't go on there and make an address change. You want to submit those address changes to the employer. Also, employees should not use my account to remove a spouse or state registered domestic partner due to divorce, dissolution of partnership. And the reason why is they're not going to get a COBRA packet sent to the house. So they want to make sure that they use a paper form in order to remove a spouse or state registered domestic partner due to divorce or dissolution of partnership. Again, we want that COBRA packet to be sent if you do it that way. If you want to make changes to life and LTD, you can use my account for that. Electing FSA or DCAP enrollment, or changing HSA health savings account contributions. My account will not be able to do that for you. Where do I find my account? So here's the main page of the PEBB website. You're gonna click on employees there, and in the top right there, you're gonna see up the right-hand corner, my account. Once I log into my account, again, you see off to the top right, you're gonna see the statement of insurance button. At that point, you can print off the statement of insurance for yourself. If I have Pay One access though, I have the ability to print off statement insurance or email statement insurance for all my employees. Again, I have to have Pay One access in order to do that. What you're going to do is on the page for the my account, you see at the top right, subscriber SOI lookup. Also, you can attest there the attestation report for people who need to attest for the spousal surcharge. And so the attestation report is going to be on the right-hand side over there. So if I make a change in Pay One, okay, I make a change online, I'm sorry. If I make a change online, again, those changes are submitted to Pay One daily. And they're going to be shared with state agencies via the Daily Trial Log 2025. You say, I don't know anything about that, as my agency turned that off. Again, you want to send a request to Fuse in order to get that turned back on. Again, the Daily Trial Log 2025 will sum up those online changes submitted to Pay One Daily that were made online. All right, medical plan changes. Not a whole bunch of stuff. Do have a new plan coming in. Just want to give you that information out there. So again, medical plan changes for 2021. For Kaiser, Permanente Northwest, and Washington. For 2021, again, covering one hearing instrument per year every 5 years at no cost. If I'm enrolled in one of those high deductible plan, the CDHP programs, then a deductible must be met before that benefit will be covered. Again, the providers cannot balance bill you for the services. Again, no cost per year every 5 years. For uniform medical plan, all the plans. For 2021, again, we're going to add a new plan option called UMP Select. Now that information is rolling in here. So again, he's like, well, where's all the information at? You know, you've got to go out to the PEBB website. There'll be the virtual benefit fair. There'll be information out there for you. Again, they have the same network providers as UMP Classic or the CDHP program. Also for UMP, for all the plans, again, covering one hearing instrument per year every 5 years at no cost. Again, the same thing with Kaiser. If you roll in a high deductible plan, the deductible must be met first, and providers cannot balance bill you for their services. Also, too, vision coverage through VSP starting 2020. Again, for more information about that, you want to go out to the PEBB website or PEBB website and receive some of that information about these coverages. For the Puget Sound high network plan through UMP Plus, they're going to add a couple of counties to their service area. They're going to do Chelan County and Douglas County. Then also, too, they're going to add a couple provider groups to their network, Confluence Health and also Everett Clinic. So again, Puget Sound High Value Network is adding a couple counties and also a couple provider groups. All right, a high dental plan, consumer directed health plan with health savings accounts. So the Healthcare Authority contribution is going to remain the same for 2021. For subscriber only, it's at $700.08 per year or $58.34 per month. For subscribers with one or more enrolled dependents, it's again the same as last year at $1,404 per year or $116.67 per month. So again, the contribution to the health savings account remained the same for 2021. The contribution amounts are changing just a little bit for 2021. For subscribers, currently it's $3,550. That is going to go up to $3,600 for 2021. If the subscriber has one or more enrolled dependents, currently it's $7,100 per year. That is going to increase to $7,200 for 2021. And as always, employees age 55 and older, they contribute additional $1,000 per year to that health savings account. Also note, employee contribution and well incentive, if they are earned, may not see it as IRS maximum for the year. Now, employees can change the contribution amounts at any time of the year. What they want to do is use the employee authorization for payroll deduction to the health savings account form in order to make those changes to their contributions. All right, Smart Health. That famous 125 incentive is going to be remaining in effect for 2021. Those deadlines, again, still going to be the same. And for employees who are enrolled with effective date January through September of 2021, it's going to have up until November 30th in order to meet the deadlines for the wellness incentive. If I am enrolled with effective dates October through December, I'm going to have to do December 31st. So again, the deadlines again for employees January through September, November 30th. And employees with effective date October through December, you're going to have up until December 31st, 2021 in order to meet the financial incentive requirements. Yes, the gift card still going to be there for 2021. Again, it's awarded for completing the well-being assessment. You have the whole entire year in order to do that, January 1st to December 31st, 2021. Once you do complete that well-being assessment, you're going to get this email. In order to claim it, though, if you don't want it, don't click on the link. But in order to claim it, you got to click on the link. This gift card is considered taxable income. Now, as a state agency through HRMS, you're going to receive this report to say who met the incentive for that, and completed the well-being assessment for that year. Now, employers also have to report that $25 in a W-2. Again, this gift card is considered taxable income. State agencies can get a report through HRMS to know who earned the gift card. Yes, premiums for 2021. Again, these premiums are just for state agencies and higher education institution employees. Here's a look at the chart for 2021 and 2020, so you can compare both of them side by side. We have the employee 2021 for all the plans here. The employee and spouse, employee and children, and the full family coverage. All right. Dental, life, AD&D, and long-term disability. For dental plans, same dental plans for 2021. Uniform dental plan, Delta Care, and Willamette. Again, no changes for dental benefits for 2021. Now, as always, it happens that people think, hey, you know, Delta Care, Delta Dental seems like the same. Okay, Delta Care and Delta Dental is different. Okay, people think Delta Care and Delta Dental is the same. They always mistakenly sign up for it. So if you have opportunity to see that somebody signed up for Delta Care during the month of November, you might want to question them just to make sure their dentist participates with the plan. Okay. Again, they want to call the plan directly to make sure dentist is part of the network. There are more information for that on the Contact the Plans and the PEBB website. Again, you want to make sure that if they select dental care, that their dentist is a provider within that network. Again, Uniform Dental Plan is group number 3000. Delta Care, again, a managed dental plan is group 3100. Long-term disability through standard, again, we have new telephone access for filing claims. That's coming January 1st, 2020. We have the phone number to contact for the Standards Claim Intake Service Center, 800-368-2860. That's going to be available Monday through Friday, 5 a.m. to 5 p.m. Pacific time. Want to make sure that employers keep up their email addresses must be updated. So if you have new contacts and stuff for your employer, you want to make sure that we are notified through the fuse that you have an update, a new employee for the benefits person that's our contact for PEBB. So again, the PERS Pay email address must be kept up to date. You want to send a fuse to the outreach and training unit. You want to update your existing contact information, only if you have a change, or you want to add a new or secondary contact. A little fact about filing a long-term disability claim. Again, information will be available on the PEBB and PERS Pay website. And this is what it's going to look like for you. Supplemental life insurance, again, a one-time enrollment window during annual open enrollment. PEBB eligible employees can enroll or increase supplemental life coverage from November 1st to November 30th. Again, I have never seen this ever during open enrollment like this. Again, employees can elect up to $1 million coverage for the employee. The EOI requires 5 questions only. If you answer no to all the questions, I believe that's good. If you answer yes, though, you have to go through the full EOI process for getting life insurance. Again, a one-time opportunity here during open enrollment to enroll and increase supplemental life insurance for the month of November. What you want to do is contact MetLife, 866-548-7139. How do I apply for that? Again, you want to go through MetLife My Benefits portal. I have a link address here. Here's a sign-on page off to the right here. Now, if you can't access the portal, again, we don't really throw people this way. We want people to go through MetLife to get this coverage. Again, PERS Pay can provide an Roll Smart enrollment form, and that form will be located on the Forms and Publications page of the PERS Pay website. Yeah, we want people to go through the portal in order to get this additional coverage or just look at their accounts. But again, this form will be available for people who cannot access that website. For life insurance, AD&E, and long-term disability, no changes to rates for 2021. When will an employee experience a rate change? For supplemental life, if you have a change in age bracket, or they may possibly increase or decrease the amount of coverage elected. For supplemental AD&D insurance, they increase or decrease the coverage elected amount. And for supplemental long-term disability insurance, they have a wage change, or maybe have increased or decreased the benefit waiting period. We'll note off to the right there for life insurance, rate increases due to change in age brackets. So if I'm going from age 50 to 54 to 55, again, that reflected January 1st the following year. So a lot more about life, AD&D, and LTD. Again, enrolling and making changes to these insurances at any time during the year, you can do that. For supplemental life AD&D, to enroll, increase, or decrease the amounts elected, again, you want to complete that MetLife enrollment change form or visit MetLife My Benefits portal online. For supplemental long-term disability, in order to enroll, increase, decrease amounts of coverage elected, you want to complete the LTD enrollment change form, and if necessary, the long-term disability evidence of insurability form. Also, we'll note at the very bottom there, for changes outside of the original 31 days of eligibility window, they may require the EOI, evidence of insurability. All right, medical flexible spending arrangement, FSA, and dependent care assistance program, the DCAP program. For the medical FSA and the DCAP, again, PEBB employees eligible or state agencies or higher education institutions, they can enroll and re-enroll in the medical FSA and DCAP. They're very, 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 very important. The employees must re-enroll every year if they wish to participate, even if the coverage amount the contribution amount remains the same. So again, if I want to sign up for 2021, I have to do that during open enrollment, and I have to enroll or re-enroll during that time period. In order to do that, though, again, to enroll and re-enroll, you want to complete Navia's 2020 enrollment form, or visit the PEBB naviabenefits.com link in order to enroll or re-enroll. I do it every year. I love it. Again, it's not for everybody, but again, it's really easy to enroll for the next year. But you have to do that if you want to enroll or re-enroll in medical FSA or DCAP. A little bit more about FSA. Again, for state agencies and higher education institution employees, they cannot be enrolled in the medical FSA and a CDHP program at the same time. So again, if during open enrollment, I say, I'm gonna sign up for that consumer directed health plan, but I'm also gonna enroll in the medical FSA. Can't do both. Okay, so if I make the mistake and go in and enroll into both those, we're gonna end up contacting the employer, and they're gonna contact the employee and say, listen, you're enrolled both in the high deductible plan and the medical FSA. We're going to give you until the end of the year in order to make that change, okay? If you don't do it by December 31st, though, you will be disenrolled for the medical FSA and remain enrolled in the high deductible plan with the HSA. Again, you cannot do both. So the first part of December, we're going to say, hey, these people are enrolled in both. Please contact them, let them know that, hey, you got to make a choice of which way you want to go. Again, if they don't make a decision by December 31st, they'll disenroll by the medical FSA and remain enrolled in the high deductible plan with the HSA account. Little side note at the bottom there, that does say medical FSA, that doesn't say DCAP. So if you want to enroll in the high deductible plan, the CDHP plan, and you want to enroll in the DCAP program, you can do that. You just can't be enrolled in the medical FSA and high deductible plans at the same time. Contribution limits for 2021. The minimum contribution remains the same as $248 per year, but the maximum annual contribution was $2,700 for 2020. That's going for $2,750 for 2021. The DCAP Assistance Program, Independent Care Assistance Program, again, it remains the same for 2021, and $5,000 annually for a single person or married couple filing joint tax return, or $25 annually for each married participant filing separate tax returns. Again, those remain the same for 2021. We have this $250 medical FSA contribution for 2021 that was, brought in last year. Again, they negotiate this in September 2018 for represented employees only. We have an annual rate of pay $50,004 or less on November 1st. And also they're enrolled in a PEBB medical plan. It's not a high deductible plan, it's a CDHP program with HSA. That $250 we distribute in January of 2021 that we pay by the employer, and no action is required by the employee. Also very important too, that amount does not count towards IRS maximum. So if I elected the full amount, okay, for the IRS contribution for that year, I can have that plus the $250. So I can have both those maximums in order for year of 2021. The employee does not have to sign up for a medical FSA to be eligible. They will receive a debit card if they don't already have one. So again, if I say, well, I lost my debit card, you got to call the vendor in order to receive that, get a new card. I have one, I use it all the time. But again, if you don't have a card there, you want to contact the plan there in order to get another one. If I don't want the monies, again, don't use a card. The funds will be forfeited. Again, if you don't want to use it, if you don't use a card, then you won't. The funds will be forfeited. You don't want to use up monies. So if the employee is enrolled in a high deductible plan with HSA, again, if I'm enrolled in a high deductible plan for 2021, I will not receive the $250 due to IRS rules. The benefit will be forfeited. What if I don't enroll in medical as a subscriber or a dependent? Then I will not receive the $250 and that benefit will be forfeited. So again, if I enrolled in a high deductible plan, I will not receive the benefit. If I'm not enrolled in PEBB medical as a subscriber or dependent, I will not receive the $250 either. Here's a letter that was sent out in late September. And for this medical FSA screening arrangement here, CBA contribution, the way your facts posted on the PERS Pay website under notices and updates section. Also in the October 4-year benefits newsletter that will be sent to employees, there will be an article under that in that newsletter about the medical FSA CBA contribution. Now, medical FSA and DCAP, they'll have a couple webinars here. Again, you want to register those webinars. The first one will be on November 3rd at 1 p.m. The second one will be November 19th at 1 p.m. And you have to go to Navia's website in order to register for these webinars. Again, November 3rd and November 19th, both at 1 p.m.
This is Jamie with Outreach and Training. Larry did a wonderful job on the first half of this webinar presentation. So I'm going to get started with the 2021 rule changes. And then toward the end, we're actually going to take a look at some of the resources online that Larry was pointing to earlier, just to give you guys an idea of where to go out and find that open enrollment information. All right, so getting started on 2021 rule changes. So these are effective January 1st, unless otherwise noted. And I will try to be clear about that as we move through. So the first one here is that language has been removed from PEB Policy 19-1A in the WAC listed here that stated previously that benefits could be terminated due to non-payment for employees on FMLA. So that language has been removed, so therefore benefits can no longer be terminated for non-payment of the employee contribution while an employee is on approved FMLA. All right, up next, this one has to do with PFML, the new Washington Paid Family Medical Leave Program, and FMLA. So for 2020, the WAC listed here, the 182-12-138, it has one section that contains information on both FMLA and PFML. So for 2021, what they've done is they've broken those two out into their own subsections. So we now have the first subsection, which addresses FMLA, and the second one that addresses PFML. And as a reminder, the Employment Security Department does determine eligibility for PFML. That is not something that we at the Healthcare Authority assist with. And I also have some information on the next slide that this leads right into, and this is just as a reminder for you all. Earlier in the year, we clarified this, but it's a good opportunity just to mention it again, and that is that Washington Paid Family Medical Leave in itself does not protect an employee's eligibility for benefits. So in order to remain eligible for benefits while on Washington PFML, the employee has to also be approved for FMLA, and that FMLA has to have at least 1 day of concurrent use with PFML. So that PFML has got to overlap or run concurrently with FMLA in order for PFML to also be protected leave. And it's only that period of PFML as well. We had a question earlier about, oh, does it protect their PFML from here on out? No, only the portion that overlapped. So if it's 2-3 weeks and it has that 1 day of concurrent use, then they're good to go. Now, with that being said, if the employee is approved for PFML but not FMLA, then in order to maintain eligibility, they have to have at least 8 hours of pay status per month. So this slide is nothing new. This is just a refresher. All right, dependent verification. So for 2020, we asked, well, it was added to policy 31-1, but we asked that whenever a subscriber is supplying a marriage certificate to verify their spouse, and they also must provide that proof or evidence that that relationship is still valid, meaning a recent bank statement, utility bill, some kind of documentation along those lines. But for 2020, we required that that documentation be dated within the past 2 months. So starting January 1st of 2021, we can receive supporting documents that are dated within the past 6 months. And just as a reminder, we cannot receive a marriage certificate only. We've gotten quite a few of those infused, and I just want to remind you all that we do require that supporting documentation. All right, partners of a legal union. So with this one, we're not talking about Washington State registered domestic partnerships. We're talking about those domestic partnerships from other states or other jurisdictions. So with this one, if we have an employee who's adding their partner from another state, remember that they do have to supply different kinds of verification, and they also have to be approved by the PEBB program. So you would send those in to us via FUSE. If that partner is allowed to be enrolled, they can only remain enrolled for 1 year. Okay, so after that 1 year is up, the PEBB program will terminate the partner's benefits unless that subscriber can prove that they've entered into a marriage, so they can supply the documentation required for that, or that they've entered into a Washington State registered domestic partnership. All right, the next one has to do with recertifications for dependent children with disabilities. So know that recertification for a disabled dependent will require renewed proof of disability and dependence. And this language has been added to PEB policy 36-1 and WAC 12-260. But I do want to remind you all that about 90 days out, the subscriber receives a letter from the healthcare authority from the PEBB program saying, hey, your dependent is due for recertification. Here's a list of everything that we need from you, and here's when it's due. So your employees are going to be notified of this, and they will know exactly what they need to submit in order to go through that recertification process. The next one has to do with extended and disabled dependents. So some language was added to the special open enrollment matrix, addendum 45-2A, that already existed in WAC. So this is nothing new. It was just language being added in a place where it should have been previously. This was the previous practice, but we're just letting you know in case you notice a difference on that matrix. So what it is if a special open enrollment event occurs that is due to the enrollment of an extended dependent or dependent with a disability, the change in health plan coverage will begin the first day of the month following the later of the event date or eligibility certification. So that eligibility certification language is what you're going to notice that's new in some of those sections. All right, so this next change has to do with the notification of eligibility. So we, as the employer, when we hire on a new employee, we have to notify them of their eligibility for benefits or their ineligibility for benefits. So regardless of whether they're eligible, ineligible, we've got to notify them of whatever that determination is. So currently, if we have an employee who is eligible for benefits, and we notify them of their eligibility, we're letting them know, hey, you have a 31-day window to submit all your required forms and your required documentation. That's it. 31 days. After that, we start talking about default. So what this change is doing is it's making it to where employees who are notified late of their eligibility, so say we've got an employee who's hired and we get busy or stuff gets buried and we end up not telling them about their eligibility until day 28 of their 31-day window. Well, the way that it works now, that employee still only has 31 days, so they'd only have a few days left to supply their required forms and documents, right? The new rule states that employees must have no less than 10 calendar days after the date of notification to elect benefits. So now the way that it works is if I tell my employee on day 28, oh, sorry, we're late, but you are eligible, they don't have 3 days left. They now have 10 days left, 10 calendar days after that date we notified them. So know that this does not affect their date of eligibility or their coverage effective date. And if you have some questions on it, I'm going to cover a scenario here that'll hopefully clarify that. So give us just a moment. All right, we've got an example of an employee whose first day of work was January 4th. So that's their date of eligibility. In this case, we've determined they're eligible for benefits. So they have 31 days after January 4th to submit their forms and their dependent verification. So that would be February 4th is their deadline. But let's say things get busy and we end up notifying them late. They're not provided timely notification. So we notify them on February 1st, hey, you're eligible. But that's day 28 of their 31-day window. So under this new rule, they now have 10 days after February 1st to submit all forms and required dependent verification. So now they have until February 11th to submit the required documents and verification. So I do want to just note that this is not an additional 10 days on top of the 31-day window. This is 10 days after they've been notified. So if you're notifying your employees of eligibility upon hire or 5 days later or even 10 days later, as long as they have 10 days remaining in that 31-day window, this isn't going to apply. This will apply when we're still in the 31-day window, but we're getting a little closer toward the end there and we don't have 10 days left yet. Okay? Hopefully that helps. All right, so I'm going to switch gears on you. This one has to do with emergency hours. So new language added to WAC 12-114. So the way that it works currently, if you were to take a look at, say, the A1 worksheet, it mentions in there that emergency hours are excluded unless they've been approved by the PEBB program. So in determining eligibility, those hours are excluded. Well, as you know, we've had COVID-19 going on, a lot of changes, and so that's what this rule is attempting to do, to adjust with these types of changes. So it states that any hours worked in direct response to a governor-declared emergency, they are not excludable. They must be included in determining eligibility. Here's some clarifying language that was added to the special open enrollments. So it was added to WAC 18208-198 and the SOE matrix, that addendum 45-2A. And we actually had a slide that was almost identical last year, and that slide read that a special open enrollment event must be an event other than an employee gaining initial eligibility. And so for 2021, they've added or regaining eligibility. So an employee who's initially eligible or regaining eligibility, they only have a 31-day window to make their elections and submit their required forms and documentation. They do not have an SOE window. They don't get 60 days. Another SOE event related slide here. So for number 12, if you were to go out to the special open enrollment matrix, this one's actually listed as number 12. It's Medicaid and CHIP. And what it's going to state for 2021 is that employees may not waive PEB medical if the employee or their dependent enrolls in or loses eligibility for coverage under Medicaid or CHIP. Now, they can make other changes as explained in the SOE matrix, but they can't waive PEB medical for the employee. All right, so this one is not a big one. It has to do with the National Medical Support Notice. So the NMSN has its own WAC. It's actually 12-263. But what this slide is saying is that WAC 12-262 now has a section that states that the National Medical Support Notice will allow for specific changes, and it provides a link directly to 262. So you'll see, I think it's A, B, C, and D, and one of them is open enrollment changes, one of them is special open enrollment, and then you have the National Medical Support Notice with the direct link to that other WAC. So they've just added this one section in there. And this WAC has to do with that continuation coverage unpaid leave. So it's language added to 12-142 and WAC 12-133. So if an employee elects to continue life or accidental death and dismemberment insurance, then both basic life and basic AD&D must also be continued. And we found that that's because the rate for the basic life and basic AD&D are actually combined. It's like $3 and some change. It's not a separate rate for basic life and basic AD&D. So because it's one rate, that's why they need to continue both. Okay, so we've got a couple more slides in regard to rule changes for you all, but the next few are specific to school employees from the SEB program, the School Employees Benefits Board program, who are leaving that SEB organization and coming to a PEB organization. So the first one here states that dependent verification is not required for those employees who are leaving a SEB organization and coming over to PEB. So if we have an employee and we know that they left a K through 12 school district or a SEB program, or they tell you that they did so and they are trying to enroll dependents, if they tell you that they've already been verified under the SEB program, you can send us a fuse. So know that this is not automatic. Oh, sorry, I didn't really get to the point here. So if they're coming from SEB, moving to PEB, they don't have to supply dependent verification as long as that dependent's already been verified under the SEB program. So if you know that you have an employee coming over from SEB, or they've told you that they're coming over, you can send us a fuse message and just provide an explanation, and then we will go into the back end and check out the verification data that exists in the system and just verify whether or not that dependent was already verified previously. And we'll let you know whether or not that's acceptable or if the employee has to supply dependent verification. So you guys might have some questions on this process, but just know that it's not automatic. There's no system out there that's going to recognize that they're coming from one program to the other. It's something we have to manually enter, manually review, and know that we're still working on the process for this. So if there's anything that changes with how you guys need to do any of it, we'll send you out a notification. But otherwise, just send us a fuse message and we'll take care of everything on our end, and we'll let you know the answer. All right, this next one also in regard to an employee leaving SEB coming over to PEB. So for employees who are coming from a SEB organization, they do not have to supply the PEB certification of a child with a disability form if they have a disabled dependent who is currently certified and enrolled in SEB health plan coverage. So they won't have to recertify just because they're coming over to PEB. Now, they will have to supply the PEB Declaration of Tax Status form to their employer, so that is required. And the recertification date to recertify that dependent is going to be the same date that it would have been had they stayed with the SEB organization. So they're not going to have a different recertification date. They'll receive a letter from PEB saying, hey, it's time for recertification. Here's what we need from you, and here's when it's due. Now, the same thing goes for extended dependents. We have employees leaving the SEB, the School Employees Program, coming over to PEB. If they have an extended dependent who's currently certified and currently enrolled in that SEB coverage, then they don't have to supply the PEB Extended Dependent Certification Form in valid court order, but they do need to supply the PEB Declaration of Tax Status form to their employer. And again, recertification is going to be based on whatever their recertification date was with the SEB program, and they'll receive a notice when that's coming up, and they'll have to supply that other documentation as requested. All right, so that's it for the rule changes. We're going to head off over to do some review on the A5 worksheet revision. So I do want to sort of head you guys off, let you know that there's nothing new with this one. This actually came out in August. So we've had some questions on it. We wanted to take this opportunity to try and clarify the understanding of transfer employees. So this is a pretty big change for some of you. And I just want to try to cover this in a way that hopefully helps everybody understand how we're now processing those transfer employees. So Gov Delivery message went out in August. I've got the link down here below, but you can find a link to that on the notices and updates section of the PERS Pay website. So what the clarification that's been included on the A5 worksheet is attempting to do is to explain when an employee is considered a transfer. Now, in order to determine if an employee is a transfer, we have to understand what a break in coverage is. So I'm going to cover that first. And then after I'm done with that, we're going to go into some detailed examples to hopefully help with understanding. So a break in PEB coverage is 1 month or more in which the employee does not receive the employer contribution. So if I'm eligible for benefits in October, but I'm not eligible in November at all, maybe I pick up my eligibility in December, then I've had a break in PEB coverage for the month of November. That's the 1 month or more, okay? Okay, so let's look at those examples to see if this helps. So I'm going to give you guys the answer before we even get started, and that is that this employee we're about to talk about is not a transfer. Okay, so that's the scenario. So in this example, we've got an employee who's leaving their previous employer. Their last day of work is November 13th. Well, that's their last day of work, employment's been terminated, and so benefits are going to end the last day of that month, November 30th. That's the way things currently work. There's no change there. Now, if that employee is hired at our organization, Remember, they left their previous PEBB organization in November, and they're hired at our organization in December, and their first day of work or their date of eligibility is any day after the first working day of the month. In this case, it's December 16th. Their coverage effective date is first of the next month. So this employee has a break in coverage for the month of December. Therefore, they are not considered a transfer. So again, I want to emphasize that they started working on a day after the first working day of the month. Okay, so then if they're eligible, their coverage effective date is first of the next month. In this case, this employee, because they're not a transfer, should be provided the appropriate A-Series worksheet, and they will receive new elections. But let's take a look at the example if we review those employees who would be considered a transfer, so the opposite example here. Same scenario with an employee leaving their previous employer. November 13th is their last day of work, so their benefits end last day of that month. That's November 30th. We picked this particular employee up with our organization their first day of work is no later than the first working day of the month. In this case, this employee came to work for us on December 1. That's their date of eligibility. So December 1 would also be their coverage effective date. So they're considered a transfer because they do not have a 1 calendar month break in coverage. So this employee, because they're a transfer, would not receive new elections. And as a reminder, there will be a recording of this posted to the PERS Pay website, so you guys will be able to review it again here in a day or two once it's up. All right, to assist with the understanding of transfer employees, you can use the first working day of the month effective date worksheet. And so I'm going to kind of show you how you can use that to assist with this. So if you think about it, if they start their first day, their date of eligibility, on or before the first working day of the month, then they're good to go. They would be considered a transfer. Any day after that, then benefits start first of the next month, they're not a transfer. So this worksheet that we're looking at on the screen now is available on the quick reference guide section of the PERS Pay website. So it's updated every year, and I'm going to highlight the November section here. So if we have an employee who left their previous organization in October, anytime in October, they came over to us, if their first working day or date of eligibility is November 1st or November 2nd, no later than the first working day of the month, then they're considered a transfer in this case. But if their first working day is November 3rd or after, then they're not considered a transfer because benefits are effective first of the next month. So hopefully you guys can sort of use this as a guide to assist you. And know that the language has been updated in the A5 worksheet. So when you're looking at that A5 worksheet, pay special attention to the examples because the examples are I think, personally, most helpful in determining transfer employees. All right, so we're moving on to some reminder information here. So this is specific to the spouse or state registered domestic partner coverage surcharge. So as you may know, many employees are required to reattest to the spousal or state registered domestic partner coverage premium surcharge every year during annual open enrollment. If they're required, they're going to receive a letter from PEBB saying, hey, you have the annual open enrollment period to reattest, otherwise you're going to incur the surcharge. And that letter is sent out at the end of October. Now, if they don't reattest during the month of November, they're going to receive another letter at the beginning of December, letting them know that they have an extension until December 31st. So in essence, they really have November 1 to December 31 to reattest. If they still fail to reattest, then in January, they're going to receive another letter that says, hey, you defaulted because you did not reattest to the surcharge, and so you're going to incur the surcharge for the 2021 plan year. So again, they have that annual open enrollment period and up until December 31st to reattest. not attesting means that they will default to incur that $50 surcharge per month for 2021. And that surcharge is going to remain in effect unless they experience a special open enrollment event that allows the change, or unless their spouse or partner has a change in their employer-based medical coverage. So now, how can you guys help your employees, or how can you stay up to date on this? So if you have access to Pay One, you'll notice that on the spouse screen, the A43 screen, that attestation is going to change to a D, and that's going to notify you that they're required to reattest. It's not really a notification, I guess, but if you were to go in there and you notice it's there, then you'll know, hey, this person's going to have to reattest, otherwise they'll default. But that's what's happening behind the scenes in Pay One. Now, for those of you who have Pay One access, you can go into your PEBB My account, as Larry spoke about earlier, and it's your very own PEBB My account, not a special one, and you click on the subscriber SOI lookup in the blue bar. And when you click on that, there'll be a green button that says Attestations Report. So you can run that report for your organization, and you can pull out all of those employees who have the Ds listed under their spousal attestation. And if you're able, you can notify them, hey, don't forget you have to do this. For those of you who don't have access to Pay One, you can send us a fuse and request that we send you that attestations report, so you guys aren't just kind of left out there on your own. We can help you with that. All right, just some annual open enrollment reminders. And toward the end, remember, we're going to take a look at that virtual benefits fair and PEBB OE webpage. So stay tuned if you want to take a look at that. All right, dependent verification is due the same time as other forms are due. So for our newly eligible employees, as a reminder, they have that 31-day window. If they experience a special open enrollment event, they've got the 60-day window to submit all of their forms in DV. But during annual open enrollment, they have no later than November 30th, which I am so proud to say this year that it's a Monday. Last year it was on a weekend, and we weren't very happy about that, but it was what it was. So, go Mondays. So if you can, and you notice that you have employees who are making changes or adding dependents, try to follow up with them and remind them that they need to submit that dependent verification by their deadline. So this has to do with the high deductible plan with the health savings account. So for employees who are changing from that high deductible plan and they're moving to a traditional plan for 2021, they have to actually stop their automatic payroll deductions or stop any contributions that they're transferring to Health Equity. It's not something that's going to stop automatically. Also, for employees who has a spouse enrolled in a medical FSA for 2021, they're not going to be eligible to enroll themselves in a CDHP with a health savings account. So they can't have a spouse enrolled in the medical FSA and have the high deductible plan at the same time. The only caveat to that is if that medical FSA that the spouse has is a limited purpose medical FSA. And as a reminder, PEBB medical FSAs cannot be made limited purpose. For those employees who are currently age 65 or who will be turning 65 in 2021, so we really discourage that we discourage their enrollment in the high deductible plan with the health savings account without seeking professional tax advice, just because there can be some issues with retroactive Medicare enrollment. So if you have any employees who are turning 65 next year, you might want to follow up with them and just say, hey, if you're considering this high deductible plan, you might want to go talk to your tax advisor first, and just be aware that that could run you into some issues next year. So employees cannot enroll or re-enroll in a medical FSA if they or their partner is enrolled in a high deductible health plan, which I mentioned earlier, or if they're changing to one for the 2021 plan year. And for people who have a medical FSA this year for 2020, who are going to enroll in a high deductible health plan for 2021, they need to use all their funds up by December 31st of 2020. Otherwise, they still have until March, but the issue becomes that they won't receive any contributions into their health savings account until April 1st if they have medical FSA funds remaining from the previous plan year. For those employees who are adding a newborn or adopted child in December, we do suggest that you key them as quickly as possible, because when those subscribers are making changes during annual open enrollment and adding a child, that can cause some issues with the carriers, just with information transferring back and forth. So just try to key that as soon as possible. And also as a reminder, that effective date of coverage for that child is going to be the date of birth, date of adoption, or date that they've assumed financial responsibility for that child. If you don't have that date, please do not key a placeholder date or an incorrect date. You can hold off if you need to, and if you're having any issues, you can send a Fuse and have outreach and training key that date for you. Please don't key an incorrect date and then send us a Fuse to correct it. It's a very difficult process. Now, of course, with that being said, if you experience an accident, send us. We do have to fix things, so send us your fuses so we can help you with the correction if needed. All right, so as you guys know, maybe some of you listening here are pretty new, but our annual open enrollment time is pretty busy, and our fuse messages get pretty loaded. So know that we are working through those. We work through them in the order received, and we do ask for your patience. We're getting through them as quickly as we can and trying to get everybody the answers that they need. But our fuse messages, our phones, our customer service lines, everything gets pretty busy during this time. But know that we will answer your questions and we will get to you. So we do want to remind you that when you send in a fuse message, if you attempt to check on the status of it by sending another fuse message on top of it, it's going to kick you to the back of the queue, because it's going to look at you like you're a brand new message. It's not going to consider your original message date. So if you don't want to get kicked back to the queue, don't send an additional message checking on the status. Know that we're working through them as quickly as we can. And also, if you can avoid sending anything unnecessary, it kind of bogs down the system, or sending duplicate fuse messages. I've seen that a lot, where people will send the same message twice. Sure, it happens by accident, of course, but please don't do that on purpose. We could end up with two different people who receive that same message, and then they end up both trying to process it, even though the other person's already gotten to it, and then you end up with just kind of this extra time being used that could have been used answering additional fuse messages. All right, and that's all I've got there for you. So agency resources. So we do, of course, have our Fuse messaging system for you guys, or you all. I apologize. I know you're not all guys. We also have the outreach and training phone number, the 1-800-700-1555. We have the PERS Pay website. All of the forms will be available out there. We're going to have these webinar recordings available on the PERS Pay website. Lots of open enrollment information there for you. And of course, there are the eligibility and Pay 1 manuals on the PERS Pay website as well. So we do ask that you do not share our information with your employees. Definitely contact us directly with questions from employees, and then you can provide them with the answers that you receive from us. So please do not provide the employees with our outreach and training phone number, our Fuse messaging system, our personal email addresses and phone numbers, or the PEBB customer service phone line. So that phone line is specific to questions for continuation coverage and retiree coverage. So if you have an employee looking forward to that type of coverage, by all means, share it, but they won't be able to answer questions for open enrollment, new hires, things like that. Not for active employees. So here are the resources that are out there for yourselves as well as for your employees. We have the PEBB website, and of course this year contained in the PEBB website is the PEBB OE webpage and the virtual benefits fair that Larry talked about earlier that we'll go take a look at here in a moment. There's also the individual plan websites. You can find links to those on the PEBB website. Navia Benefits Solution has their own webpage and phone number, as does Health Equity. MetLife also has their own customer service line along with their own website, although you can find information on all these benefits on the PEBB website. These direct resources will be the best for employees to reach out to for questions with those benefits. And then we also have a special phone number and webpage for the Smart Health Wellness Program as well. So employees should be reaching out to their plans directly with questions about benefits and claims, to request new ID cards, checking to see if their providers in network, things like that. We don't expect you guys or you all to be able to answer questions like that, and those are things that we can't answer either. So they should be reaching out directly to their health plan, and information and contact info for those health plans is available on the PEBB website, and it's on the back of their benefits ID card as well. Some things that they should be contacting you all with are questions on eligibility or changes in eligibility, enrollment questions, enrollment procedures. They have any questions on the premium surcharges. They have difficulty finding forms. They would like to add or remove dependents, and they're wondering about their special open enrollment event. If they have questions on life or long-term disability eligibility and enrollment, of course, if it's something that you can't answer, we do want to direct them to MetLife for those life insurance questions. And if they have questions for payroll deduction, all things that they would come to you with. And our website got a new facelift last year, which was really exciting, and it's changing every day, of course, with the open enrollment information. But we do have our PEBB section for public employees on the main website here, and then in the middle we have our school employees section, so that's specific to the SEB program. On the right-hand side, we've got our retirees webpage. So if you have anybody looking forward to retiring, they can go there to find more information. And then at the bottom, we have our continuation coverage section, and there is a different section for PEBB and for SEB. So we definitely want to make sure employees are going out to the correct one for their type of coverage. So I am going to walk you all, oh, sorry about that. I have a guest today. Out to the PEBB website real quick. I apologize. Alrighty. Oh, wrong one. Okay, so I believe you all can see my screen now. So I am going to go to the Employees and Retirees Benefits website. All right, perfect. And we got the web link up here. It's the www.hca.wa.gov/employee-retiree-benefits. Hopefully you are all very familiar with this website. As I scroll down just a little bit here, you can see that there are links to the Open Enrollment, SEB, and PEBB web pages, but I'm going to take you directly to the Public Employees page. This is a great landing page for our employees. This is where I come all the time for information. All right, so now that we're on this main Public Employees page, you can see My Account up here in the top right-hand corner. Zoom in here a little for you. And then in this lovely family photo here in the middle, we have a link directly to the Open Enrollment webpage and another direct link to the Virtual Benefits Fair. So I'm just going to do a really quick review with you all. I'm not going to go into anything too detailed. I just want to show you where to locate this and a little bit about it so that you can go out when you have time and take a deeper dive. All right, perfect. So the first thing here, it says open enrollment, and on this page we have the 2021 benefits and plan changes, premiums and benefit information, newsletters, benefits fairs, webinars. There's going to be webinars that employees can register for, and then the supplemental life insurance enrollment opportunity that Larry covered earlier. So as I scroll down, it has a section for where do I find changes that affect me? What changes can I make? How do I make those changes? And if you're asking about that new health plan, there's information in here on that UMP Select plan as well. So I'm going to keep scrolling down. I want to show you all a couple of things. So Larry covered this earlier, but here is a section for the Facebook Live event that employees can attend. And then the webinars, this will be the only other thing that I open up from this web page. Oh, just one moment, everybody. It looks like I got unplugged. We'll have to thank the group chat for that notification. I'm plugged in, but not plugged into the wall, so it doesn't really count. Okay. So I just clicked on the webinars link, And we've got these nifty little drop-down boxes here. I'll click on Kaiser non-Medicare. So it talks about the webinars that they're offering, what the dates are, and it has registration links. So we've got it for Kaiser, Uniform. It looks like Willamette is doing their own. And then there are webinars for the Medical FSA and Dependent Care Assistance Program, and a webinar for long-term disability insurance. So employees can come right out here now and they can get registered. All right, so I'm going to open up the virtual benefits fair link. This will be the last one we'll take a look at. So it opens up with Dave's face right here up front, so they can watch a little note from our directors. Really nice. And as I scroll down, it asks, who are you? Are you an employee, a retiree? And you can select that you're an employee if you're looking for employee information. And then it takes you right to the 3 sections: medical, dental, or additional benefits. That additional benefits are going to be things like the life insurance, the medical FSA and DCAP, and so on. So I'm going to click on medical benefits, and you can visit the different booths for the different benefits here to learn more about those health plans. And this is where you're going to find information on that UMP Select plan that's new for 2021. So we highly suggest you all come out here and take a look at the benefits fair and familiarize yourself with it in case you get any questions from your employees. And this concludes the 2021 pre-open enrollment webinar for state agencies. Thank you for watching.